Hi everyone, my name is Natalie Ventura Torres. I'm going to talk about acute methotrexate-induced crystal nephropathy. My accounts are these. Please check them because I will upload medicine content. Let's start. First, the definition. Acute renal failures occur in approximately 2% of patients who receive a high-dose methotrexate for the treatment of an hematological condition. Intratubular crystal formation does occur in humans during the course of methotrexate-induced acute renal failure. Certain types of urinary crystals are known to form or to undergo structural modifications in the bladder, or after micturition because of change in pH, temperature, or bacterial activity. Methotrexate. Taking methotrexate for as little as 3 days in a row is enough to cause serious consequences, including sepsis and death. Since 2000, at least 8 Australians have died and many more have been hospitalized after taking too much methotrexate. Methotrexate use is increasing, which has corresponded with an increase in accidental daily dosing reported to Australian Poisons Information Centres. Methotrexate is effective and safe if used correctly.
Used to treat rheumatoid arthritis and many other autoimmune and inflammatory conditions. In fact, it's the first line of treatment for most people after they're diagnosed, and it serves as the gold standard against which other treatments are evaluated. In most people, methotrexate does not cause any problems. We also give a prescription for a vitamin called folic acid to take every day while you are on methotrexate. This helps to cut down many of the possible side effects. Sometimes another vitamin, folinic acid, or leucovorin, is also used. Methotrexate can infrequently have some effects on the blood, like lowering white blood cells and red blood cells. Methotrexate is also metabolized in the liver. To be sure there are no problems with your liver, blood tests will need to be done, and usually this is about once a month when you first start methotrexate, and then when you're on a stable dose, this usually spreads out to about every.
Applications in medicine. Methotrexate is in a class of medication called antimetabolites. Methotrexate treats cancer by slowing the growth of cancer cells. Methotrexate treats psoriasis by slowing the growth of skin cells to stop scales from forming. Methotrexate may treat rheumatoid arthritis by decreasing the activity of the immune system. Methotrexate is also sometimes used to treat Crohn's disease, multiple sclerosis, and other autoimmune diseases.
Will occur. Most of the time, these will lessen as your body gets used to the methotrexate, but if side effects continue or really become troublesome, check with your doctor or nurse. Get emergency help if you ever have any signs of an allergic reaction, like hives, difficulty breathing, swelling in your face, lips, tongue. That's very, very rare though. Methotrexate can sometimes, rarely, cause an inflammation in your lungs. If you experience a cough or shortness of breath, let your doctor know. Methotrexate is not associated with an increased risk of cancer, but it's important to recognize that people with autoimmune diseases do have a risk for cancer anyway, just because they have an autoimmune disease. There are some medications you should generally avoid with methotrexate. Trimethoprim, Bactrim, or Septra acts on some of the same pathways, and methotrexate may need to be held while you're on those medications. There is a
Pros and cons. Pros. Methotrexate is one of the most effective medications to treat rheumatoid arthritis. According to the National Rheumatoid Arthritis Society, more than half of people taking it see a 50% improvement in the course of their disease. It will help ease symptoms like joint pain, fatigue, redness, and swelling. It may also help prevent damage to your organs and joints.
What are the side effects of methotrexate? Methotrexate can lower the power of your immune system to fight germs. If you have signs like loose stool, a new cough, a new sore throat, or burning when you use the restroom, please let your doctor know right away. About 1 to 3% people get mouth sores, hair loss, and abnormal blood counts. The folic acid pill taken with the methotrexate lowers the chances of getting mouth sores and hair loss a lot. While taking this medicine, you must remember that all side effects do not make you sick, and that's why blood work has to be done every 8 to 12 weeks to make sure you're doing fine. Methotrexate can hurt your liver, but this happens in people who are at the risk of getting liver disease from other drugs that they're taking or from heavily drinking alcohol. A cough that doesn't go away or trouble breathing that keeps getting worse may rarely come from methotrexate hurting your lungs.
Cons. Acute tubular injury with numerous intratubular and interstitial deposits of unique appearance. Acute renal failure can occur even in the absence of toxic methotrexate levels in plasma 24 to 48 hours after infusion. Antimetabolite levels in plasma are better correlated with an increased risk of crystal formation than are the levels 24 to 48 hours after infusion. Increase the creatinine concentration in plasma.
About the side effects. It may be surprising to know that 70 to 80% of people don't get problems with methotrexate. I'd like to talk a bit about the 20 or 30% of people who may get problems. Typically, the problems will occur 1 to 2 days after taking it, and it is a weekly medication. The most common ones here would be headache, a foggy feeling in the head, or nausea. This may require dose adjustment, or occasionally, if it is very bad, we would have to use a different medication. Other side effects may include mouth ulcers or hair loss, but usually we can manage this with dose adjustment or using some other medications to counteract that. You will require some monitoring of blood tests with methotrexate. Typically, this would include the liver test and full blood count. If there are abnormalities here, usually we don't need to discontinue treatment, we just need to adjust the dose.
Issue of lighting equator. A great problem that exists in the world is disobedience on the part of the patient, since in some cases they want a quick recovery and begin to consume more than the recommended dose. In other cases, not having enough money, they decide to stop the treatment abruptly. In both cases, the adverse effects are enormous and it is produced by the patient.
The tubule of the nephrons, crystal-like structures can form. The crystal-like structures are essentially precipitants of some electrolytes that have accumulated there. This crystal is actually a urinary stone. If the crystal is small, it will just pass in the urine. But if it remains in the kidneys, in the nephron, it can grow bigger and become a kidney stone. A kidney stone, again, is basically a big crystal. The kidney stone can lead to an obstruction. The obstruction within the tubule can create a buildup of pressure in the tubule. This pressure can cause irritation, and this irritation is read by the brain as renal colic. There is also an inflammatory process going on due to the obstruction, and this also leads to the renal colic, the pain we feel when there is urinary stones in the body. Alternatively, the urinary stone can lodge or get stuck within the ureter. Remember the sites of constriction of the ureter? Well, the stones can get stuck there, and when this happens, irritation and pain can occur due to stretching of the fibers that are there, which are caused again by the increase in pressure within the ureter. With this increase in pressure proximally to the site of obstruction, and with the irritation going on, edema can occur, and the ureter will contract more vigorously, trying to push the stone out. This is called.
And for the conclusion. The use of the methotrexate is appropriate for the treatment of rheumatoid arthritis and autoimmune diseases, but it should be administered with a great caution only once a week because its adverse effects are innumerable, such as liver damage, lung damage, a decrease in the number of blood cells, increase the risk that you will develop a lymphoma, life-threatening skin reactions. Therefore, it is essential to follow the doctor's recommendations and follow the treatment to the letter and not change the amount of dose prescribed by the professional. Thanks for watching my video.